Hello, dear elephant lovers. Welcome back to another emotional episode in which we join to save these wild animals and rescue their valuable lives. Do you remember the elephant we treated a few days ago who was suffering from a trap gunshot wound to its lower leg? It was in serious pain at that time. And here is the next treatment session that was carried out 3 days after the first treatment session, if you haven't already. Make sure to watch the previous video by clicking on the link attached in the first comment. This will help you notice the improvement in its condition. After assessing the elephant's body weight, the veterinary doctor carefully prepared a calculated dose of anesthetic medication, proportionate to its weight. The elephant was then put under sedation. They used a tranquilizer gun to dart the elephant from a distance. Given that the elephant was roaming close to a water source, the sedative process was challenging. They had to carefully guide the elephant out of the water source, as it's not advisable to sedate an animal while it's in water. Darting the elephant required tremendous effort. Amid all the commotion, we were unfortunately unable to capture footage of the sedation process. After about 15 minutes, the elephant was fully sedated, so its eyes were covered. The action could help the officials in treating the elephant safely, without any aggressive behavior. Officials rushed to inspect the wound on the leg. They confirmed that the wound has been recovering. This second treatment session would bring more recovery to the wound. All these tasks were carried out quickly and carefully, because they had to complete all required treatments before the elephant returned to his usual aggressive habits. As always, the officer gets started by cleaning the wound using a disinfectant solution. He injected more disinfectant solution into the abscess to ensure that it was thoroughly cleaned. The officials then remove any pus and necrotic tissue from the abscess. While some officials were asked to treat the wound, another group of officials were injecting the necessary dosage of antibiotics, multivitamins, anti-inflammatories, painkillers, and all other medications required to heal the wound. All these medications were decided by the veterinary doctor based on the body weight of the elephant. After extracting all pus and necrotic tissues from the abscess, a solution containing povidone iodine solution and negasunt powder was applied to the wound. Following that, more negasunt powder is applied to the treated region. The final procedure was to spray an antibiotic solution onto the treated area. The treatment process has come to an end, so the revival drug is administered through the elephant's ear vein. This female elephant was first noticed by a villager who was passing by to collect firewood. A huge, extremely painful abscess was forming in the elephant's leg, and the villager noticed that the animal was in poor condition. Fortunately, his quick reaction in notifying the wildlife conservation team about the elephant's terrible condition helped in the healing process. So, as we mentioned at the conclusion of the first video, this is the second mission to treat the unfortunate animal to boost its recovery. The ranger officer who was tasked with keeping an eye on the elephant's progress informed the wildlife conservation team that the time was perfect to conduct the next treatment process. Additionally, he reported that the elephant was doing well and was showing positive signs of recovery. The wildlife conservation team immediately gathered their resources after obtaining the positive information from the ranger officer. That is when the veterinary team joined them to reach the elephant's location, packed with medical equipment. This huge abscess was a result of a trap gunshot injury. According to a recent investigation involving wild elephants, it was revealed that many cruel individuals employ trap guns to keep animals from destroying their crops. These traps are usually intended for capturing small animals like pigs, rabbits, porcupines, and deer. While the goal may be to avoid and prevent wildlife from destroying crops or capturing small animals for bushmeat, there is a possibility that unintended victims, like elephants, will be caught in these traps. Trap guns are manufactured from simple materials like wood, leather, metal, and rubber particles. Therefore, if large animals, such as elephants, are caught in these traps, they may rush towards the forest without proper medicine, causing infection in the wounds and huge abscesses. This poses an enormous risk to all wild animals in the forest. Investigations are carried out to identify any criminals who engage in such criminal behavior. The veterinary doctor scheduled another treatment session to make sure the elephant was completely cured. Let's pray for a speedy recovery for this majestic giant, and may he once again grace the forest with his presence and grandeur. Let's meet again with another mission carried out to treat an innocent wild animal.